One complaint I often hear from people is that they suffer and feel they almost pinch in the front of the hip. So if you come up, some people say it's tightness, but if you're coming up and pulling the knee to chest or crossing over this way and you feel that tightness or pinch in the front of the hip, usually we're getting some compression in the joint. First and foremost, you probably want to get checked out just to make sure there's no issues in there with the labrum or the joint itself. But what you can also try is adding into a little band mobilization into the hip flexor stretch. So a lot of times, if you look at the way the hip is set up, so we have the joint here on the pelvis, and then we have the femur. So from sitting and being in these hunched over positions, sometimes that femur will translate anteriorly this way. So as you go ahead and now lift up, the joint pinches a lot easier. So we can go ahead and add a anterior to posterior mobilization on the hip to help get that joint more centrated. And a lot of times people then pull up there and they no longer feel that pinching because that joint is in a better place. And obviously we're sometimes stretched out through the anterior capsule, tight through the posterior. So we're getting that position, we're sitting in that position that's causing the pinching. So what you can do is getting a strength band, again, it needs to be a pretty strong band, can't be a regular TheraBand. If you loop that around something, and you're going to put that on the down leg of the hip flexor stretch. So you have to go all the way up as high as you can into the joint, so it's up through the groin here, right around the outside. So if you think the bump on the outside of the hip is here, it's slightly above that point. We're going to stretch that band out as much as we can. We're going to go down into the hip flexor stretch, back up tall. Same principles here. We're not trying to change the hip flexor stretch whatsoever. We're just adding this anterior to posterior mobilization with the band. Back up tall. Again, hips kind of tucked under here. Easy lunge forward. So we're pulling that head of that femur back into the joint here to put that in a good position. And we're just going to hold that stretch 30 to 60 seconds. And you can nice and easy rock into that for a few seconds and relax. You can go through short pulses there. And always remembering, don't aimlessly lunge into this stretch because that oftentimes causes that head of the femur to translate forward, which could cause this problem as well if you're doing the stretching incorrectly. But try adding the band onto that hip flexor stretch if you're feeling any kind of pinching in the joint. That could make a big difference there, but definitely opening up the hip flexors, some good glute strengthening, and mobilizing the hip, and see how that changes your situation. Thank you.